Hi there, welcome to Study Race. Today we are going to study about psoriasis. Psoriasis is a common condition that affects about 125 million people worldwide. It is not contagious and is not caused by poor hygiene. The exact cause of psoriasis is unknown, but it is thought to be caused by a combination of genetic and environmental factors. Psoriasis is a chronic autoimmune disease that causes the rapid buildup of skin cells. This buildup of cells causes the characteristic red, scaly patches that are associated with psoriasis. Psoriasis can affect any part of the body, but it is most common on the scalp, elbows, knees, and torso. The exact cause of psoriasis is unknown, but it is thought to be a combination of genetic and environmental factors. Psoriasis is not contagious. There is no cure for psoriasis, but there are treatments that can help to control the symptoms. Treatment options include topical creams and ointments, light therapy, and oral medications. Psoriasis can be a difficult disease to live with, but there are many resources available to help people manage their symptoms. The National Psoriasis Foundation is a great resource for information and support. There are 4 types of psoriasis that are plaque psoriasis. This is the most common type of psoriasis. It causes raised red patches of skin covered with silvery scales. Plaque psoriasis can affect any part of the body, but it is most common on the scalp, knees, elbows, and torso. Guttate psoriasis. This type of psoriasis is caused by a streptococcal infection. It causes small, red, drop-like spots on the skin. Guttate psoriasis usually goes away on its own within a few weeks, but it can come back. Inverse psoriasis. This type of psoriasis affects the skin folds, such as the armpits, groin, and under the breasts. Inverse psoriasis causes smooth, red patches of skin that may be moist or weeping. Pustular psoriasis. This type of psoriasis is characterized by pus-filled blisters on the skin. Pustular psoriasis can be very painful and can affect any part of the body, but it is most common on the hands, feet, and trunk. There are other, rarer types of psoriasis, such as erythrodermic psoriasis and psoriatic arthritis. Now, let's have a look at causes of psoriasis. Genetics. Psoriasis is a chronic condition that is thought to be caused by a combination of genetic and environmental factors. If you have a family history of psoriasis, you are more likely to develop the condition. Environmental triggers. There are a number of environmental factors that can trigger psoriasis flares, including stress, injury or infection, certain medications, smoking, alcohol, and weather changes. Other factors that may contribute to the development of psoriasis include age. Psoriasis is most common in adults between the ages of 25 and 50, but it can occur at any age. Gender. Psoriasis is slightly more common in men than in women. It is important to note that psoriasis is not contagious. You cannot catch psoriasis from another person. The symptoms of psoriasis can vary from person to person, but some of the most common include scalp psoriasis, which can cause dandruff-like scaling and hair loss. Nail psoriasis, which can cause the nails to become pitted, ridged, or crumbly. Pustular psoriasis, which is characterized by pus-filled bumps on the skin. Guttate psoriasis, which is characterized by small, drop-like lesions on the skin. Red, inflamed patches on the skin. These patches are called plaques and they are the most common symptom of psoriasis. They can appear anywhere on the body, but they are most common on the elbows, knees, scalp, and lower back. The plaques can be itchy, sore, or tender. Dry, flaky skin. Psoriasis can cause the skin to become dry and flaky. This is because the skin cells in people with psoriasis reproduce too quickly. The dead skin cells build up on the surface of the skin and create a scaly rash. Itching and burning. Psoriasis can cause the skin to become itchy and burning. The itching can be severe and it can make it difficult to sleep. Pitted or ridged nails. Psoriasis can also affect the nails. The nails can become pitted, ridged, or crumbly. In some cases, the nails may fall off. Joint pain. Psoriasis can also cause joint pain. This is called psoriatic arthritis. Psoriatic arthritis can affect any joint in the body, but it is most common in the hands, feet, and spine. Psoriasis is a chronic condition, which means that it is long-lasting and there is no cure. However, there are treatments that can help to control the symptoms and improve quality of life. If you have any of the symptoms of psoriasis, it is important to see a doctor to get a diagnosis and discuss treatment options. Here are some lifestyle management tips that can help to improve psoriasis symptoms. Avoid triggers. Some people find that certain things trigger their psoriasis flares. Common triggers include stress, dry skin, infections, certain medications, smoking, alcohol, and certain foods. If you can identify your triggers, you can try to avoid them or minimize your exposure to them. Keeping your skin moisturized can help to reduce dryness and flaking, which can make psoriasis symptoms worse. You can use a moisturizer that is specifically designed for people with psoriasis. Stress can trigger psoriasis flares, so it is important to find ways to manage stress. Some helpful stress management techniques include exercise, yoga, meditation, relaxation techniques such as deep breathing or progressive muscle relaxation. Eating a healthy diet and exercising regularly can help to improve overall health and well-being, which can also help to improve psoriasis symptoms. A healthy diet includes plenty of fruits, vegetables, and whole grains. Exercise should be moderate and regular. In addition to these lifestyle management tips, it is also important to see a doctor for treatment. There are a number of medications that can help to control psoriasis symptoms. There are a number of treatment options available for psoriasis. The best treatment for you will depend on the severity of your psoriasis, your individual needs, and your doctor's recommendations. Topical creams and ointments. Topical treatments are applied directly to the skin. They are the most common treatment for psoriasis and are often used as the first line of treatment. Topical treatments include corticosteroids. Corticosteroids are the most common type of topical treatment for psoriasis. They work by reducing inflammation and slowing the growth of skin cells. Corticosteroids are available over the counter and by prescription. Vitamin D analogs. Vitamin D analogs work by slowing the growth of skin cells. They are available by prescription. Calcipotriene. Calcipotriene is a vitamin D analog that is available over the counter. Coal tar. Coal tar is a natural substance that has been used to treat psoriasis for centuries. It works by reducing inflammation and slowing the growth of skin cells. Coal tar is available by prescription and over the counter. Light therapy. Light therapy, also known as phototherapy, is a type of treatment that uses ultraviolet, UV, light to treat psoriasis. There are two types of light therapy. Narrowband UVB is the most common type of light therapy for psoriasis. It is delivered by a special lamp that emits a narrow band of UVB light. NB-UVB is effective in treating mild to moderate psoriasis. PUVA. PUVA is a combination of oral psoralen and UVA light. Psoralen is a medication that makes the skin more sensitive to UV light. PUVA is effective in treating moderate to severe psoriasis, but it can have side effects such as nausea, vomiting, and sensitivity to sunlight. Oral medications. Oral medications are taken by mouth and can be used to treat moderate to severe psoriasis. Oral medications include methotrexate. Methotrexate is a chemotherapy drug that is used to treat psoriasis. It works by suppressing the immune system. Methotrexate can have side effects such as liver damage, anemia, and mouth sores. Cyclosporin. Cyclosporin is an immunosuppressant that is used to treat psoriasis. It works by suppressing the immune system. Cyclosporin can have side effects such as kidney damage, high blood pressure, and increased risk of infection. Acitretin. Acitretin is a retinoid that is used to treat psoriasis. It works by slowing the growth of skin cells. Acitretin can have side effects such as birth defects, liver damage, and hair loss. Biologics. Biologics are a type of medication that is made from living cells. They are used to treat moderate to severe psoriasis that does not respond to other treatments. Biologics work by targeting specific proteins that are involved in the development of psoriasis. Biologics can have side effects such as infection, infusion reactions, and increased risk of cancer. If you have psoriasis, it is important to see a doctor to discuss treatment options. There is no cure for psoriasis, but there are treatments that can help to control the symptoms and improve quality of life. Living with psoriasis can be challenging, but it's important to remember that you're not alone. There are many resources available to help you manage your condition and live a full and happy life. Support groups can be a great way to connect with others who understand what you're going through. They can provide emotional support, practical advice, and a sense of community. There are many different types of support groups available, so you can find one that's a good fit for you. Psoriasis can have a significant impact on your mental health. It can cause stress, anxiety, and depression. If you're struggling with your mental health, it's important to seek professional help. A therapist can teach you coping mechanisms and help you develop a treatment plan that addresses both your physical and mental health needs. It's important to be open and honest with your healthcare team about your psoriasis. They can help you develop a treatment plan that's right for you and answer any questions you have. If you're not sure what to ask, your healthcare team can help you. There are many celebrities who have spoken out about their psoriasis, such as LeAnn Rimes and Cyndi Lauper. These celebrities can be a source of inspiration and support. They can show you that it's possible to live a full and productive life with psoriasis. People with psoriasis are at an increased risk for developing a number of other health conditions, known as comorbidities. Some of the most common comorbidities associated with psoriasis include psoriatic arthritis, type 2 diabetes, cardiovascular disease, and depression and anxiety. Psoriatic arthritis is a type of arthritis that affects people with psoriasis. It causes inflammation in the joints, which can lead to pain, stiffness, and swelling. Psoriatic arthritis can affect any joint in the body, but it most commonly affects the joints in the hands, feet, spine, and neck. People with psoriasis are more likely to develop type 2 diabetes than people without psoriasis. Type 2 diabetes is a chronic condition that affects the way the body metabolizes sugar. People with type 2 diabetes have high blood sugar levels, which can lead to a number of health problems, including heart disease, stroke, blindness, and kidney disease. People with psoriasis are also more likely to develop cardiovascular disease than people without psoriasis. Cardiovascular disease is a group of diseases that affect the heart and blood vessels. It includes heart attack, stroke, and heart failure. People with psoriasis are also more likely to experience depression and anxiety than people without psoriasis. Depression is a mood disorder that can cause feelings of sadness, hopelessness, and worthlessness. Anxiety is a mental health condition that causes excessive worry, fear, and nervousness. The exact link between psoriasis and comorbidities is not fully understood. However, it is thought that the chronic inflammation that is associated with psoriasis may play a role in the development of these other conditions. Additionally, people with psoriasis may be more likely to have certain lifestyle factors, such as smoking and obesity, that increase their risk for developing comorbidities. There is no cure for psoriasis, but there are a number of treatments that can help to control the symptoms. Treatment for psoriasis usually involves a combination of medications, lifestyle changes, and self-care. Researchers are constantly working to develop new treatments for psoriasis. Some of the most promising new treatments include biologics. Biologics are a type of medication that targets the immune system. They are often used to treat severe psoriasis that does not respond to other treatments. Gene therapy. Gene therapy is a type of treatment that involves using genes to treat a disease. Researchers are working on developing gene therapies that could be used to treat psoriasis. Cell therapy. Cell therapy is a type of treatment that involves using cells to treat a disease. Researchers are working on developing cell therapies that could be used to treat psoriasis. Researchers are also working to better understand the genetics and immunology of psoriasis. This research could lead to new treatments and a better understanding of the disease. With continued research, it is possible that a cure for psoriasis will be found in the future. However, it is important to remember that psoriasis is a complex disease, and it may take many years to find a cure. Let's now brush up what we learned today. Psoriasis is a chronic autoimmune disease that causes the rapid buildup of skin cells. The symptoms of psoriasis can vary from person to person, but they often include red, scaly patches of skin. Psoriasis can affect any part of the body, but it is most common on the scalp, elbows, knees, and back. There is no cure for psoriasis, but there are treatments that can help to control the symptoms. Some common treatments for psoriasis include topical creams, light therapy, and oral medications. Psoriasis is thought to be caused by a combination of genetic and environmental factors. The exact cause of psoriasis is unknown, but it is thought to be triggered by certain things, such as stress, infections, and certain medications. Psoriasis is not contagious. Psoriasis can be a very difficult condition to live with, but there are many treatments available that can help to control the symptoms. If you have psoriasis, it is important to see a doctor to get a diagnosis and treatment plan. Some tips for managing psoriasis may include: moisturize your skin regularly. Avoid scratching your skin. Use sunscreen to protect your skin from the sun. Manage stress levels. Eat a healthy diet. Get regular exercise. If you have psoriasis, it is important to talk to your doctor about the best way to manage your condition. There are many treatment options available, and your doctor can help you find the right treatment plan for you. At last, thank you everyone.